Welcome at this video lecture about joint injuries in the horse. To show you a little bit more, let's start with the joint anatomy. You have a joint, there are two bones making contact with each other. There where they make contact, they're covered with cartilage. It's smooth and makes it easy to move. Around that joint is a joint capsule, keeping the fluid in there that's made by the synovial membrane. That fluid is called the synovial fluid. And to keep that joint really together, there are two ligaments called the collateral ligaments, and some joints do even have more of those ligaments, and they keep it together. Let's go to a schematic view of that. What you see here in red on top of the bones is the joint capsule. It's really like a plastic bag. It's around those two bones, and it keeps the fluid in there. Outside, or at least on the outer side of the capsule, are two green structures, and they are the collateral ligaments that make that joint move in one or two directions and prevent it in moving in another direction. When we go to a little bit more lifelike picture, let's go to the picture in the low left corner. What you can see on top, the blue, that's the cartilage, and the yellow, that's the synovial fluid that's in between the cartilage. And the first layer of that pink layer was the synovial membrane, and the synovitis is a cell in that synovial membrane. They make the synovial fluid, and on the outside of the synovial membrane you have some blood vessels. So in the joint there are no blood vessels in the cartilage. There are only blood vessels in the capsule. This picture shows you a bit more in detail a collateral ligament. The black structure is the collateral ligament. It's made of collagen, and it's really sitting on the side of the joint. This is the fatlock, and it's sitting on the side of the joint to make it possible to move forward and backward, but not to move to the side. So they're really important stabilizers in your joint, and a very important structure of your joint. And quite often they are one of the structures that get damaged, and then you have a problem. When we look into cartilage, it's made in the fetal stage, and then during the first year it can maybe regenerate a little bit. After that it's done. It's there, and it only can get worse over time. When you look how cartilage is made, it's really like a network of all kinds of fibers and structures woven into each other. So it's a little bit flexible. It has some cushioning effects, and it's very, very complex. I'm gonna try to explain that a little bit more in some schematic views to show you. You have like a fiber network of collagen fibers. It's 3D, goes in all directions. Within that, here in red, you have hyaluronic acid that's made into that, long molecules flexed into it. Here in the other color, glucosamines, also long molecules, part of that network. And then some cells are there, the gray bulbs, and they are the chondrocytes. The capsule around it is not that elastic. It's quite thin, and it really contains nerves and blood vessels. And if you ever flexed your ankle and it's really painful, then you know, because that's what you do. Your capsule gets a little bit enlarged, you get a big ankle, and it's really painful. The capsule doesn't really give a lot of stability to the joint. It's really just keeping the fluid in, and taking care of bringing nutrients to the cartilage. The collateral ligaments are much stiffer. They're attached to bone. They don't really have a lot of metabolism. What quite often happens is that the primary structure is your stability injury, and after that you get problems in your collateral ligaments. They become less elastic, and then quite often they start to give it the possibility for more movement in that joint. And that's what you see on this picture here. When the ligaments are a little bit less elastic and widened and strengthened and lengthened, and then suddenly that joint can move in a direction that normally is not the case. And when that happens, it can easily make contact with a part of the cartilage in a different way that is normally loaded. So then you introduce cartilage damage. So very often you start with some collateral ligament damage. That's initially, and if you go on moving that horse, moving that joint, you end up with cartilage damage. And when you have the injury of the capsule, quite often that gives you a little release of cytokines and prostaglandins, substances that really induce inflammation. They take care of making the blood vessels getting bigger, more blood flow through those blood vessels in the capsule, and then you get more synovial fluid. And that's what you know when you get a big joint, it's effused, there's more fluid in there. Let's look at the picture again. What you can see here, you see the release of substances coming from the synovial membrane, and they diffundate into the joint. They change the quality of the synovial fluid, and over time they even start to change the cartilage. So even if you have just capsulitis, inflammation of your capsule, and not really directly cartilage damage, over time, if that stays there long, even the degradation of those substances make that your joint will deteriorate too. And what happens when your cartilage gets damaged is that the network structure is going to be damaged. Some of the parts of the cartilage are coming out of that network. When they get damaged, they also start to release cytokines and prostaglandins. That makes that this cartilage, the network structure, starts to fall apart more and more, and over time, the cartilage has a hole. We'll go into a little bit more detail. We see here the cartilage, like I showed you in one of our earlier pictures. It's that network when it's intact. What you see here is that the white area here damages one cell. That's the initial injury. What happens is all the red dots, that's the release of cytokines and prostaglandins. What happens when that happens is that it eats away a little bit of your network structure, so you get a hole in the network structure. And after a while, a white blood cell comes in and starts to eat away all that tissue. It's a cleanup reaction. And by doing that, it really damages even more your network structure. After a while, that cell converts into a different cell and starts to make new tissue, but the new tissue is never as good as the cartilage. So what you get there is another network structure that looks comparable to what we had before, but it's not the same quality. And after a while, you end up with a piece of cartilage that has a lower quality and a lower capacity than the tissue around it. Here you see that at the left, normal tissue. In the middle, you see that the upward layer of the cartilage is damaged. And when you go more to the right of the image, you can see that all the cartilage is damaged. You have like big gaps in there, and you see the purple surface on the bottom of the picture. That's where the bone is. That's when you really get the bone. When the bone gets damaged underneath it, you can imagine that joint is really at the end of its stage. And here we have a real picture of how that looks like. It's a stifle, and what you can see on the right is that it's not a normal color. You have all kind of erosions in the middle, and also when you look at the capsule around it, it's like enlarged and quite red and like proliferated. That's really a joint in the end stage of arthritis. Here you see a picture of inflammation of the joint capsule. That's called capsulitis. And when there is inflammation of the synovial membrane, that's called synovitis. And if you have inflammation of the collateral ligaments, that's called desmitis. And quite often an injury of a joint gives a combination of one, two, or all three of those problems. And it's really good to realize that it's a very complicated thing. When you have a synovitis capsulitis, it's just a soft tissue of the joint. It's completely reversible, and that's really good. If you take away the primary cause, then you can go back to a normal joint. When you wait too long and the synovitis capsulitis goes on, you end up in having arthritis. That's really when the cartilage damage is there. The cartilage will be repaired, but you get scar tissue, and there is no healing possible of this. It's just management trying to keep that joint in a good working condition, and really realize that wear and tear on a joint, what's a form of arthritis, is a normal aging process. It's only a problem when the joints age much quicker than the rest of the horse. Okay, until this, thanks for watching this. We'll post some more videos on treatment on joints. Thank you.